Can your doctor pick you out of a lineup? Do you feel like you're introducing yourself every time you make an appointment, even though you've had the same doctor for years? When's the last time you didn't have to wait weeks or months, then sit in a waiting room for hours for a 15-minute appointment? What if I told you I spend 30 minutes to an hour with my doctor every single time I see her? Would you believe me?
Direct primary care is a model that allows the physician and the patient to have a direct relationship. That's really how it got named, and is supposed to be a return to essentially what medicine used to be, what healthcare used to be, that especially family medicine, right? We started family medicine in the 70s with the idea that primary care ought to be able to help people live happy, healthy lives, and that it's easier to do a good job of helping people do that within the context of their family. Because as we know, part of our own health is influenced by the people that we live with and are around often, right? So I have a bias toward family medicine, of course. I'm a family medicine physician. And then I practiced in the corporate structure, and I just realized in various ways over the years that I couldn't really take care of patients the way I had thought I would be able to when I was young and maybe naive and excited and headed to med school. So then I learned about this direct primary care movement and realized it started in Seattle with some people who trained me actually. And so they were talking to me about their excitement with it. And it really just means that since primary care is not supposed to be a super expensive endeavor, it's supposed to be an inexpensive thing. And corporate medicine has just made it really expensive, right? So direct primary care is a low monthly membership fee that basically the equivalent of a cell phone, usually cell phone bill. And then paying that every month allows you to see your doctor virtually like this via a virtual visit or phone call or even text messages through secure health apps that are encrypted, or in person in the office like normal. Everything that the physician knows how to do is just included in that fee. So it's accessibility, it's price transparency, it's unrushed appointments, and it's you getting to know your doctor and your doctor getting to know you so that you get the type of care you need instead of a cookie cutter model of symptoms and treatment.
I can definitely say that I absolutely appreciate the fact that I am not rushed and that you and I do have the relationship that we have because as a patient, we're supposed to be able to advocate for ourselves. And I don't think a lot of people have that or feel comfortable doing that when they know they have a set 5 minute, 10 minute, 15-minute time that they say, oh, never mind. I guess I didn't really want to talk about that one thing.
And the doctors, honestly, and the doctors don't like that either, right? I'm the same person now as a direct primary care doc that I was as a corporate medicine physician. And you can imagine how happy I was with trying to be me inside a 15 to 20-minute appointment.
I can't even imagine you trying
Well,
to keep.
yeah, I wasn't ever very good at it, right? I wasn't ever good at the 15 to 20-minute thing. And so patients would just be in the waiting room forever.
You make an appointment with your doctor, it takes you weeks or months to actually get this appointment. And then you're waiting around for an hour or two because they're running behind because somebody else is doing something and their 15 minutes went over. I hated that.
Or even worse, I did OB, right? I was high risk. I'm a high risk OB trained. And so sometimes people would wait a couple months for their appointment, couple hours in the waiting room, only to learn that I had to rush off through the side door to go deliver a baby.
Yes,
That was an extra wrinkle, but
that would be very disappointing if I was sitting in the waiting room and somebody said, oh, by the way, we have to reschedule you and we're looking at another 6 weeks.
I would butt in usually at that point and say, you can't push these people off 2 months, right? So sometimes they would just let me work an extra half day in clinic or something to be able to get those people back in. But there had to be a certain ratio of physicians to nurses, and there had to be clinic availability. And we were always asking, mother, may I, right? To try to take care of patients the way we knew they needed to be cared for. So I like not having to ask permission.
So, who do you think the ideal patient is for somebody who is looking at moving to a DPC?
Well, I think everybody deserves a direct relationship with their physician. I recognize that not everyone wants one. Some people really do fine with corporate medicine because they're used to it. They only ever go for the one preventive visit a year that's fully covered by their insurance, and they don't have a copay and they don't have surprise bills for that. But that's really the exception. Most patients, even if they were the once a year type of patient, they would come with a list of things they wanted to discuss, right? That's natural, organized, prepared. I have a few things. A preventive visit, though, that your insurance pays for only allows us to do this set of things. If you want to get my quick opinion on your back pain, hormone therapy, anxiety, any of those things, I have to code that separately. And that will be a problem based visit. And your insurance will send you a bill in the mail some point in the future. And understandably, they would be frustrated. But I learned the hard way to say that up front because the surprise bill months later would not make them happy. Right. And that was hard because patients would say, oh, never mind, then I don't even want to talk to you about those things that are bothering me. And as a physician, that was really hard. Now you don't care about your anxiety. Now you don't care about your back pain that may or may not be
At
something
that
serious.
point, you can't really advocate for yourself because the health insurance is putting the kibosh down on that.
Well, and
You're,
they're afraid because they don't know
yeah.
how much. They would ask me, well, how much is it going to be? And I'm like, I have no idea. So I would say everybody is a good candidate for DPC, but there aren't enough DPC docs yet, right? There there's the whole element of the golden handcuff where I'm pretty fortunate to be able to leave my corporate job and have my husband foot the bill for our life for a while I start this adventure and ultimately make enough money to contribute to the economic landscape of my family, right? But not everybody can do that. I still have student loans from med school. There are very real factors that make it so that a lot of docs can't leave the corporate structure. And so there aren't enough DPC docs. So then we look at who benefits the most. And I would say the patients who have sought me out and seem to benefit a lot are those who maybe have been ostracized from mainstream medicine. They're definitely transgender patients who feel like they aren't well known or well received within the corporate structure. There are people who are very nervous about having their health records be part of the Epic EMR system because it's a huge system and it's interconnected, and some people just really fear that.
As they should, because there was that recent article where the doctor in Texas ended up going through and pulling records from patients.
But we all have to use an EMR, right? As a small direct primary care, I can't foresee us being on the Epic system. And then I think people who really value working on their health. So any age, but the corporate medicine structure is built on, and my formal education in medical school was aimed at helping me realize who's sick, who's not sick. If they're sick, is it a right now type of illness or is it a chronic disease? If it's a right now type of illness, treat that. If it's a chronic type of illness, help them understand that, bring them back fairly frequently. For example, diabetes. We were always taught, help them with their diabetes, bring them back in 3 months. Well, I can tell you that you're going to be much, much healthier if I'm able to have much more frequent communication with you. If that's the kind of intensity and educational time and all that that you want, great. We have that flexibility. But if, as somebody with a diagnosis of diabetes that is an everyday type illness, it's a lot easier to help people learn how to manage that if we're able to touch base pretty frequently and talk about what XYZ nutritional plan did to their sugars, or just all the touch points, right? So my hope in the direct primary care world is actually to be able to do testing and evaluations that I know are good for patients so that we can get a sense of whether there's disease lurking down the line, get a sense of it now. But in the corporate structure, if we have to ask insurance, are we allowed to order these particular tests? Insurance says no, right? But in the direct primary care world, I can say, I recommend these things. I have negotiated a much better price with the lab, so we can have me order them. You will be billed by me, and I can tell patients exactly how much that'll be, and they can say yes or no. And then I can help them learn about potential problems when they're real small and not wait till they become huge. And I can help them manage them. So, again, if you want to be a proactive person, I think DPC is a good model. And DPC seems to be a really good model for people who are helping take care of other people, like mom or dad taking care of little kids. If you want to know, does this cut need stitches? Do I have to go to the urgent care right now? People can send me a picture of that through the health app, and we can just talk about it quickly. Do I have to pack up the family and go to an urgent care in Astoria, or can I stay here at Cape Disappointment for a night or two? People who also want to save time and have that convenience are good DPC patients as well.
Fantastic. And I did note that there are just about 1,000 DPC providers in 48 states to 250,000 patients. 1,000 providers is not a whole lot in the grand scheme of the number of doctors in the US. So I know that I am lucky that I have you, but I wish that there was a way to help people realize that that is the way that we should be moving towards, and to unshackle from health insurance and pharma and all the things that are tying us down to where we are not making the best choices for ourselves, because
I
we
agree.
don't. And that one is that. Oh my gosh. So we have really touched on basically everything that we're just able to just talk about it, because this is such an amazing thing. So here's a fun fact that I'm sure that everybody is really thrilled and wants to know. I have firsthand experience with your surgical skills, and I have the scar to prove it. How normal is something like what we did? Is that a normal DPC thing where you and we talked about my skin, and you said, I'm going to take this piece of flesh from your abdomen and send it in, and then you're getting stitches, young lady? Is that normal? Is that a DPC thing, or is that just an Erin thing?
Well, now I do believe I didn't force you to do it. I do hope at least that I said, hey, this looks like it would be better if it weren't part of you. Are you okay with me taking it away? But if you're asking what kind of procedures and things, family med is still the most common direct primary care doctor set, right? We now have specialists who are doing direct primary care, which is amazing. There are some gynecologists, some rheumatologists who are doing this DPC model, and that is phenomenal. But family docs in general are trained to do all the things, pregnancy and then cradle to grave medicine, and we are trained to do procedures. Because I was high risk OB trained and did C-sections and things, I have more comfort maybe with surgical procedures than some people do, and joint injections and things like that. But I think for the most part, most DPC docs do office procedures. And then it depends on the special interest of the doc, really, right? I wanted to be able to offer Botox for migraines because a neurologist friend of mine here in Tacoma said, you have to learn how to do this because people cannot get in. There are not enough neurologists doing this. It's a straightforward procedure. So I learned how to do that. And then my friend said, could you please learn how to do Botox for my wrinkles as well? And so I learned how to do that. And again, it's just whatever I have an interest in learning, I can learn and then offer in the clinic. Some procedures are just part of the membership fee, and some are an extra charge. But even if they're an extra charge, it's an upfront, totally transparent pricing thing that patients can say yay or nay. I want it
Yeah.
or I don't want it. But yeah, I think joint injections, basic biopsies, sewing up lacerations, sewing up cuts that require it, taking off toenails that need to be removed for infectious reasons. I think most of the DPC docs do those types of things. Freeze off warts, that kind of stuff.
Well, I'm sure we'll get into it later on down the road when we talk more in depth about all the things that I've been through, because that's part of this series is you and I are the same age and we're going through the same things. And I've definitely been thrilled with how the whole weight loss thing for me is gone. And I think that a lot of people would be interested in knowing from a doctor who actually believes in the system that we're going through and that we're doing, and not just fear mongering, is going to be really helpful in the future.
Sure.
And then my whole ADHD thing. There's going to be so many fun things that we're going to talk about in this series, because
Great.
it's a lot of things that individuals and people who are our age, and I'm not afraid to say that I'm going to be 49 this year, will get value from. And I'm really hoping that we can continue this series and you and I can delve deeper into more interesting conversations. But I really was glad that you could do this, because DPC for me has been game changing.
Oh, that's cool.
This has been my glow up year and taking care of myself year. And I don't think I could have done that without you. So
Well,
I'm
that's super nice. I'm glad.
really, really thankful that you and I have been able to spend all this time together. And my last thing is, I haven't personally found any, but are there any downsides to consider with going with a DPC as opposed to standard health?
Are there downsides? It is a monthly fee, right? So that makes some people very nervous. I think what I've heard is, well, if I'm only going to go 2 times a year, is it really going to pencil out? And I would say maybe not. If you have good insurance and you're only going to end up spending whatever it is you spend per month on your insurance, and then the one copay or two copays for having gone to the doctor, then it may not pencil out. But I think what I would say to that is that DPC in that sense may be considered a drawback. We pay for insurance when we would be bankrupted potentially or have a significant financial hit if something were to happen, right? Like homeowners insurance. We don't generally invoke our homeowners insurance when we need to repaint the house. That's just part
Yeah.
of taking care of the house. I don't even think you can ask for insurance to pay for that. If a tree went through it, that's what you need your insurance for, right? Big, huge, catastrophic expenses that you didn't expect. That's when it's nice to have insurance. I think when people are trying to figure out whether DPC makes financial sense, it works out better if people opt for a high deductible plan through their employer or whatever, knowing that they can get all the preventative stuff, all the healthcare stuff, often meds, labs at very reduced prices, so that they will then actually be proactive and go to the doctor with the little things instead of thinking, I don't know if I need to see the doctor about this or not because it'll probably go away, right? So I don't feel like I'm being clear, but the
No,
idea that
you're making perfect sense, because catastrophic insurance is one thing that, you know, coming from somebody who is currently dealing with the fact that my son had, broke a leg and has no insurance, and it's $30,000 in hospital bills, versus going to the doctor and saying, "Hey, I stubbed my toe and broke it. Can you just wrap it and fix it?" It makes sense to have a catastrophic plan when you have a DPC who you can go see and you can go and advocate for yourself with, and not wait 30, 60, 90 days before you get in, and that toenail or
exactly. I think unfortunately catastrophic plans are not what they were before with the Accountable Care Act. They've changed, but there are plans, according to the benefits manager that I was learning from, there are plans that are called 8550 plans where the max you'd pay out of pocket is 8,550, and you have this high deductible so that home insurance, you would just pay out of pocket along the way for the things that you want to do or have done, and it would be inexpensive with the direct primary care. And then if something happened, such as you're describing, where you have an acute issue and you have to go to the ER, or you have a significant diagnosis and you need specialist care and all that, then you have that plan that kicks in so that it saves you from bankruptcy or something. Because healthcare is
Yeah.
still top of the list or close to the top of the list for reasons that people go bankrupt, right? And the uninsured, those are the other people for whom the DPC is a really awesome option, right? Because then they can actually get care. Because I think I've heard such horror stories about patients who pay 500 to 1,200 a month for their actual insurance, and then they also have to pay co-pays, co-insurance, all this kind of thing. So
Healthcare is absolutely broken, and there's got to be a better way for families to deal with this. And I think that, in all honesty, DPC has been amazing, and that's why I'm I'm the biggest cheerleader for it.
It's growing. It really is growing. I just had the DPC Alliance, the DPC conference this last weekend, and it's bigger and bigger and bigger every year. And there is a DPC Alliance now that is starting to be big enough to do lobbying. And on the East Coast, there's a healthcare system that actually has contracted with DPC docs instead of employing family medicine docs, so that the referrals come from the direct primary care. And that system has shown improved patient satisfaction, improved physician satisfaction, and improved health outcomes at a reduced cost to the whole health system, the hospital included.
That is absolutely amazing.
So it's growing, it's becoming more and more proven. And the beautiful thing about the DPC world is that we don't view each other as competition. There's several DPC docs in the Tacoma, University Place, Gig Harbor area, and one on the way to Silverdale as well, I believe now. And we collaborate. Every DPC doc really wants to have between 300 and 600 patients on our panel, as opposed to when I was in corporate medicine and I would have 1,500 to 3,000 patients on my panel, right? Like you said, I didn't even meet a lot of those people, because how in the world would I have even been able to get all of those patients on my schedule, right? So we want to be able to make it so that patients can have same day or at least same week access to us. And because we want to make sure that we always have unrushed appointments where we can actually talk about what's going on and come up with a real, as a physician, be able to ask enough questions to have an honest opinion about what might be going on, and then a discussion about what we should do going forward to make it better. We don't ever want to have a huge number of patients on the panel. And so we need lots of DPC docs. I'm never sad when I see another person say, I'm going to start a clinic, right? Like, even if they started one next door to me, fine, great. All have individual personalities. We all have individual interests. So it's a matter of finding the right DPC for you.
Yeah, no, oh gosh, that's so fantastic. Okay, well, absolutely appreciate you spending this time with me, Dr. Erin. It was
I appreciate you inviting me.
Of course. So you're going to come back and we're going to talk more about other fun stuff.